Obesity has reached epidemic proportions, with nearly 40% of adults and 20% of children worldwide now classified as obese, according to the World Health Organization. This alarming trend is linked to over 2.8 million deaths annually. Obesity significantly increases the risk of chronic conditions such as type 2 diabetes, cardiovascular diseases, and even certain cancers, as highlighted in a 2023 study published in The Lancet. But the impacts go beyond physical health. Emerging research from the Alzheimer's Association in 2024 has revealed a strong connection between obesity and cognitive decline, including a 60% higher risk of Alzheimer's disease in individuals with excessive visceral fat. These findings underscore the urgency of addressing obesity not just as a lifestyle issue, but as a critical global health challenge. Recognizing its widespread impact is the first step toward collective action.
One of the most groundbreaking discoveries of 2025 is the concept of obesogenic cellular memory. Research published in Nature Metabolism reveals that fat cells retain a memory of past obesity through epigenetic changes, even after significant weight loss. This may explain why nearly 80% of individuals who lose weight through dieting regain it within 5 years. This discovery underscores the limitations of short-term interventions like calorie restriction alone. Effective weight management will require innovative approaches to reset the cellular memory of obesity. Potential strategies include prolonged dietary adherence to counteract metabolic inertia, pharmacological therapies targeting epigenetic modifications in adipose tissue cells, and behavioral and psychosocial interventions to support long-term lifestyle changes. These insights call for a rethinking of weight loss programs, prioritizing sustained interventions over rapid solutions. With these emerging strategies, researchers and clinicians are redefining the future of sustainable weight management. Recent studies reveal a compelling link between visceral fat and Alzheimer's disease. Elevated visceral fat levels correlate with increased amyloid protein deposition in the brain, markers of cognitive decline that may appear up to 2 decades before symptoms emerge. This connection reframes visceral fat as more than just a metabolic concern. It is now recognized as a critical neurological risk factor. Public health strategies must address this dual threat by prioritizing preventive campaigns promoting visceral fat reduction through balanced diets and regular physical activity, advancements in imaging tools to monitor visceral fat levels and associated neurological risks, and integrated care models that focus on both metabolic and cognitive health. Shifting the focus from treatment to prevention could significantly reduce the healthcare burden in aging populations, fostering healthier outcomes for future generations. Ultra-processed foods are a driving force behind the global obesity epidemic. A landmark study published in Cell Metabolism in 2023 found that diets high in ultra-processed foods result in an average increase of 500 calories consumed per day compared to minimally processed diets. These foods are designed for hyperpalatability, combining high sugar, fat, and salt to override natural satiety signals. The impact of ultra-processed foods extends beyond overconsumption. Research from the Journal of the Academy of Nutrition and Dietetics links these foods to metabolic dysfunction, inflammation, and increased risk of chronic diseases. Addressing this challenge requires bold action. Regulatory measures, such as taxation, advertising restrictions, and clearer food labeling, are essential to reduce accessibility and appeal. Public education campaigns must highlight the hidden risks of ultra-processed foods and empower consumers with healthier choices. Food innovation can play a transformative role, producing affordable, minimally processed, and nutrient-rich alternatives that meet the needs of diverse populations. Policymakers, public health advocates, and the food industry must unite to reshape the dietary environment. By tackling ultra-processed foods head-on, we can address the root causes of obesity and promote a healthier future.
GLP-1 agonists have transformed obesity treatment in recent years. Medications like Ozempic, Wegovy, and the groundbreaking Mounjaro have shown unprecedented success in helping patients achieve significant weight loss. Research published in the New England Journal of Medicine in 2024 highlighted that Mounjaro, a dual GLP-1 and GIP receptor agonist, delivers average weight loss exceeding 20% in clinical trials. These medications work by mimicking natural hormones that regulate appetite, improve insulin sensitivity, and reduce food intake. However, challenges remain. These treatments are expensive, limiting access for many. Expanding insurance coverage and developing generic options are crucial for equitable availability. With the potential to redefine obesity care, GLP-1 agonists represent a new frontier in weight management. By addressing both biological and behavioral aspects of obesity, they offer hope for millions struggling with this chronic condition. Addressing obesity requires a multifaceted approach that targets its root causes and promotes sustainable solutions. Based on the latest research, here are 5 key strategies to combat obesity. Adopt multimodal interventions. Combining medications, behavioral therapies, and dietary changes offers the most effective and sustainable results. Focus on visceral fat reduction. Regular exercise and balanced nutrition not only improve metabolic health, but also protect against cognitive decline. Limit ultra-processed foods. Replacing nutrient-poor, calorie-dense foods with fresh, minimally processed options can significantly reduce weight gain. Improve accessibility to anti-obesity medications. Expanding insurance coverage and promoting affordable treatment options ensures equity in care. Invest in prevention and education. Equipping communities with resources and knowledge empowers individuals to make healthier choices. By integrating these strategies, policymakers, healthcare providers, and individuals can work together to combat obesity effectively and create a healthier future.
In this video, we've explored obesity through multiple lenses, uncovering key insights and strategies. In Segment 1, we discuss the global impact of obesity, highlighting its role as a critical health challenge linked to chronic diseases and cognitive decline. Segment 2 introduced the concept of obesogenic cellular memory, explaining why sustainable weight loss often requires more than diet alone. Segment 3 emphasized the link between visceral fat and cognitive health, revealing its role as a neurological risk factor. Segment 4 focused on ultra-processed foods, identifying them as a major driver of the obesity epidemic. In Segment 5, we highlighted the rise of GLP-1 agonists like Mounjaro, revolutionizing obesity management through groundbreaking therapies. Finally, in Segment 6, we outlined actionable recommendations from multimodal interventions to public education and policy reforms. Looking ahead, the fight against obesity requires a collective effort. Collaboration among individuals, communities, and policymakers is vital to shift the focus from treatment to prevention. Investments in education, equitable access to advanced treatments, and sustainable public health policies can pave the way for long-term solutions. By leveraging science, innovation, and shared responsibility, we can turn the tide against obesity and create a healthier future for all. Together, small steps today can lead to transformative changes tomorrow. The content provided in this video is for informational and educational purposes only. While every effort has been made to ensure the accuracy and reliability of the information presented, it is based on publicly available data and verified scientific literature at the time of recording. However, ongoing research and developments may lead to updates or changes in the field. Viewers are encouraged to consult with qualified healthcare professionals or specialists for personalized medical advice and to verify any information with official sources, including peer-reviewed studies and regulatory guidelines. Medical health tips. Live assumes no responsibility for errors, omissions, or the outcomes of decisions based on the content of this video. Always prioritize professional consultation for health-related matters.
Struggling with obesity? The right foods can make a world of difference. Backed by science, here are the top 5 powerhouse foods to support your weight management journey. 1. Leafy greens. Studies published in Nutrients highlight how fiber-rich greens like spinach and kale reduce hunger and calorie intake, making them a must-have for weight loss. 2. Whole grains. Research from the American Journal of Clinical Nutrition confirms that whole grains like oats, quinoa, and brown rice improve satiety and help regulate blood sugar levels, reducing cravings. 3. Lean proteins. High-protein foods like chicken, fish, tofu, and legumes are shown to boost metabolism by up to 30%, according to a study in the Journal of Nutrition. 4. Healthy fats. Contrary to myths, fats from sources like avocados, nuts, and olive oil can promote fullness and improve heart health, as supported by research in the Lancet Diabetes and Endocrinology. 5. Berries, low-calorie and high in antioxidants. Berries like blueberries and strawberries are proven to combat oxidative stress and inflammation, which are often linked to obesity, according to studies in the International Journal of Obesity. Incorporating these nutrient-dense foods into your meals isn't just about weight loss. It's about overall health and sustainability. Remember, healthy eating is about nourishing your body while making smarter, evidence-based choices for a healthier you.
This video is brought to you by medicalhealthtips.live. If you found this information helpful, please subscribe, like, and hit the bell icon to stay updated.